First thing to say is that the evidence that not going to school damages children in the long run is overwhelming, and that includes their long-term chances. It increases the risks of disparities, entrenches problems, deep-rooted problems that people may have. It increases the risk that they have mental and physical ill health in the long run. So school is an incredibly important thing for children. Now, set against this, there's obviously the risk that parents reasonably are worried about their children going to school and catching COVID, and that this causing long-term damage to them that way. So what we lay out is the other risks, and the first thing to say really clearly is there is overwhelmingly clear evidence that the chances of children dying from COVID are incredibly small. And every single death of a child is an absolute tragedy, but the great majority of those very small numbers, both in the UK and internationally, have been in people who've got significant pre-existing health conditions. There's also very clear evidence from the UK and around the world that children much less commonly get severe illness, and they end up having to be hospitalised if they get symptomatic COVID at probably a rate of less than 1/10 of that of the general population. And there's some evidence that children, particularly primary school children, are actually less likely to catch COVID in the first place. So the reason that's important to lay out is the chances of children catching COVID and then getting long-term serious problems as a result of it, solely due to going to school, are incredibly small. They're not zero, but they're incredibly small. The chances of many children being damaged by not going to school are incredibly clear, and therefore the balance of risk is very strongly in favour of children actually going to school, because many more are likely to be harmed by not going than harmed by going, even during this pandemic.